how serious is the problem of obesity today?
More than 1 billion people currently are obese and more than 2.5 billion people are overweight. And it is increasing. Like in Canada itself, if you say 20 years back, 1 in 5 people were obese and now 1 out of 3 they are overweight or obese.
70% of urban population in India is obese. Based on the world, it might be third most obese country in the world. Do you agree?
No, there are many other countries which are still above India.
Oh. What are the main causes of obesity though?
Lifestyle and food, stress, and a lot of people go into stress eating. Diet and exercise is meant for maintaining your weight, but weight loss can be temporarily, but in the end, within 2 to 3 months, diet, exercise, everything fails. Only 4-5% people can lose and maintain in long term.
What is the youngest patient that you have treated and the oldest patient you have treated?
Yeah, that's interesting. Yeah, youngest I have treated is.
So what are the risks of belly fat?
Belly fat is called central obesity. So central obesity is more dangerous than generalized obesity.
Can it also cause cancer?
Yeah. So everywhere the Western food has taken over.
They spoiled everything.
Yeah. Most of the people can't eat slow. It's a very simple, but they can't. They are wired to eat fast.
Yeah.
From stomach to the brain, it takes about 15 to 20 minutes to send a message that I am full. And then brain will tell you stop eating.
When do you think a person should go for surgery for weight loss?
35 body mass index and onwards.
You cannot regain weight after surgery. Do you know that there is a capsule that when you swallow, it transforms into a balloon in your stomach and it takes up the space so that you could eat less? I myself did not know about this until today after having a conversation with Dr. Girish Juneja. Dr. Girish Juneja is a world-renowned bariatric surgeon who is based in Dubai with over 20 years of experience. And I got an opportunity to speak to him and interview him while he was here in Canada. He has helped many patients to lose weight through surgical and non-surgical methodology. And in this conversation, we went deep into the root causes of obesity and how we can build a disease-free lifestyle. You know, personally, I could relate with this conversation so much because while I was growing up, I was obese. And that somewhere down the line impacted my physical as well as mental health. So this podcast is for all those people who are looking to make physical transformation so that they can lead a better and confident life. Enjoy the show. Welcome, Dr. Girish.
Thank you. Thanks for inviting me to your studio.
The pleasure is all mine. Why do you think this conversation about obesity is important?
See, obesity is a very serious sort of medically it is labeled as a disease, chronic disease, and it causes so many problems in the body which people are not even still aware despite increasing public awareness. So this is the root cause of many diseases which happens in the body. Okay. And it is increasing despite a lot of intervention at the government level, by the medical societies. Still it is increasing and leads to a lot of diseases which may be mechanical, respiratory, diabetes, hypertension, even including cancers in long term.
So in this conversation, we're going to talk about from basic to intermediate level of like how to get to weight loss, why obesity is a prominent kind of an epidemic here in the world today. Just before talking about all of that, you have a brilliant background. You come from UAE and you have been one of the most successful bariatric surgeons for weight loss, and you do surgeries and non-surgical treatments as well. Yeah. Can you give a brief introduction about what you do and how you do it?
See, my basic bariatric training was in Netherlands. And then I we 2 or 3 surgeons introduced bariatric surgery 20 years back in UAE. Mm-hmm. And I was heading the departments of surgery in various hospitals in Abu Dhabi and in Dubai also, like Al Zahra in Abu Dhabi, in Dubai and in Abu Dhabi Mediclinic. And since last year I am into my own practice in 2 hospitals based in Dubai. Now, coming to surgery, bariatric surgery itself, there are different levels of interventions from non-surgical to surgical, and in between 2 levels there is an endoscopic level. So in 3 methods we can reverse the associated problems and the weight loss. We can bring back the weight of the person back to near normal or normal. Mm-hmm. That's how it happens here.
Okay. And how do you think, how serious is the problem of obesity today?
It's a worldwide problem, and it's a very serious problem. As per different agencies, different studies, including WHO, more than 1 billion people currently are obese, and more than 2.5 billion people are overweight. So you can understand, and it is increasing. Like in Canada itself, if you say 20 years back, 1 in 5 people, 1 out of 5 were obese. And now 1 out of 3, they are overweight or obese, despite interventions and all those awareness programs and all. So it's a very burning problem in the society, and it has to be addressed at multi levels.
Yeah, I was reading somewhere that even in India, I mean, they don't have the whole report about India because it is very vast and they cannot uh, consolidate all the data. What I read was that 70% of urban population in India is obese, and if you consider, like, based on the world, it might be third most obese country in the world. Do you agree?
No, there are many other countries which are still above India.
Oh.
Indian obesity rate, of course, in urban is very high, but overall Indian population, if we see, then we can say around 10%.
10%.
Yeah, and in Middle East, it's about 30 to 40%.
Wow.
So India is still at the lower level.
India is at a lower level
Yes.
beside having so much of population.
Exactly. So
But
big
since-
number of population, and then city life versus rural areas,
Yeah.
it makes difference. But so when we talk about the country, then we have to take the whole population sample. So currently, still it is below, like American, Europeans, and Middle East. They are above India.
Tell me about Middle East.
Middle East, yeah, it's a very significant problem in Middle East. We can say 30 to 40%. Male obesity is around 30, female obesity is around 40.
Female are more obese than
More
male
obese
in
than
Middle
males.
East.
In Canada, for example, here we are talking about, so it's approximately same. One interesting part, male obesity, if it's 28% in Canada, female obesity is 26%. They are comparatively more healthier and less obese as compared to the males in Canada.
So women are more healthy here in Canada
Yeah, we can say from obesity point
from
of
an
view.
obesity point of
Yeah.
view. Wow.
2% less.
Yeah. And what do you think is the major cause of women getting more obese in Middle East in comparison to males?
Here, women are more active. They're more of a traditional family structure is there. Less working women are there. Maybe that contributes. And of course, there are other factors which we'll discuss down the line.
So I remember, when I was growing up, and like I told you earlier in our previous conversation also, that I was very fat. So I was around 90 kgs when I was 15 years old. So, but your surroundings don't make you want to make you feel that way sometimes also. Like your parents don't want you to feel that, you're fat. They'll say you are healthy.
Yeah.
Right? So do you think that even today that why obesity is not considered as a disease?
Now, for last few years, for example, American Society, British Society of Medical Society, they have labeled it as a chronic disease.
They have.
Now, slowly it's filtering down
Right.
to the medical community and then to the population that it should be treated as a chronic disease like any other chronic disease like high blood pressure, hypertension, diabetes. You have to go for medications, management. So in medical society, it started labeling as a chronic disease. Of course, in normal population and household, still is considered because of overeating or because of less exercise. It's not considered as a disease, but I think with time, people will be more aware and start taking it as a disease rather than blaming a person for overeating food and etc.
Yeah. So, I mean, most of the time, what happens is that I think it's very difficult to even judge a person is an obese or not. Like, for example, in my opinion, or I could be wrong also, but a person who is really, really, big, and you see that, the arms are big and the legs are big, only that person is considered as obese, or there are different, like, how do we scale up to the level of saying that this person is going through obesity?
See,
Because they could be in different phases, right? They could not.
Yeah.
They could be chubby, but still not like very
Yes.
very fat.
Exactly.
How do you make that out?
So the simplest way of calculating, which is not 100% accurate, but it gives you a fair idea, is called BMI, body mass index. Means weight in kilograms. If you divide by height in square meters, the figure comes up. If it's below 25, then it's not considered overweight or obese. From 25 to 30 is considered overweight. Above 30 body mass index, BMI, is considered obese. So it gives a fair idea about that. Yeah. So now obesity person can be healthy obese and can be metabolically bad obesity causing different diseases. But slowly with time, even the healthy obesity goes into the bad obesity. But the fair idea you can get from body mass index.
What is the difference between hyperplastic and metabolic obesity?
These are the medical terms. Hyperplastic means your number of fat cells are more. And the metabolic means it's more of the obesity which causes diseases in the body, metabolic diseases. The commonest is the diabetes, hypertension, cardiac problems, cholesterol. This is called metabolically active obesity.
So they get activated over the period of time, and hyperplastic obesity is you're born with it, is it?
Yeah. Hyperplastic up to teenage level, adolescent level, number of fat cells can increase. After that, their numbers will not increase, but their size can increase.
So basically, in hyperplastic obesity, at the end of the day, even in metabolic obesity, like the same number of cells the size increases to that level, like for metabolic also, but it happens over the period of time.
Over the period, yeah.
Okay.
The size starts increasing.
Is it also genetically, like for hyperplastic?
Genetics also play a role. Genetics, familial environment, those kinds of things also plays a role, significant role in hyperplastic or during their childhood. And later on, the acquired factors takes over.
What are the main causes of obesity though?
The top main points we can say lifestyle and food, especially the processed food, rich in sugar and fat is the main cause. Number two, not active lifestyle. Means you are more of a couch potato or not doing exercise or walking, those kind of things. These two things are the main acquired factors in getting obese. And plus, there are multiple factors are also there.
Like most of the time when patients come to you, like what do you think, how do they get to that level?
Beside these two things,
Yeah.
Stress, and a lot of people go into stress eating. To release stress, they take the shelter in the food, and a lot of you can say now whenever you go for a social gathering, drinks, alcohol is one of the factor, and when you do a lot of socialization, drinks, along with drinks you have plenty of food, so all this combined together it's a slow increase, and once you notice it, then already it's a bit late. So these are the main factors which contribute.
Can you give any story from one of your patients, like how why did they come to you after experiencing this kind of a change in their body? Like what was their main cause of expecting now I want to make changes, I want to transform my body, and nothing else is working? How does that happen for any of your patients?
Yeah, see, when a patient comes to a surgeon, nobody wants to come under a surgeon's knife. So they keep trying, successfully or unsuccessfully, half-heartedly, the diet and exercise. These are the two main things. Even if you go for any weight loss procedure, diet and exercise, these two things has to be there. Now, they try, but in a long term, if you see, medically, if statistics you see, diet and exercise is meant for maintaining your weight. But weight loss can be temporarily, but in the end, within 2 to 3 months, diet, exercise, everything fails. only 4-5% people can lose and maintain in long term. So these two factors they do, then they go for another kinds of medications, and then they go for non-surgical ways of reducing weight, but ultimately they spring back to their original weight or maybe more. And when all these things fails, then they come to us that nothing is working up and now we want to have it. Mostly comes when they detect metabolic active disease in their body. Then they get scared.
What does that mean?
Diabetes, hypertension, high cholesterol,
Okay.
a lot of things. And like weight gain can cause gallstones also.
Then cause?
Gallstones,
Okay.
gallbladder stones.
Gallbladder.
Yeah, so when these things starts developing, and other mechanical factors like they start having back pain, they start having knee pain because of overweight. When they walk, they get breathless. So these are the things which sets alarm in them, and then they approach to us.
Okay. So it is like obesity can lead to hypertension, diseases, other body aches also.
Yeah.
And the treatment is treating obesity first and then looking into other factors like what else is happening to your body. Like, is that what is also recommended, or is it that it has to go simultaneously with other?
It goes simultaneously, but when weight loss happens, the body's hormones are reset. So practically, all these things, if they come within time, for example, an obese person develops diabetes, and then he gets scared, that I'm getting diabetes, and then they come to us. If he comes within 5 years, 60 to 70% of chances that it will be reversed back to normal.
Okay.
If they come within 10 years, chances are 40 to 50%. Beyond 10 years, chances are more or less. So there is a period during which effectiveness of the bariatric surgery, reversing these metabolic problems, are very high.
Wow. What is the youngest patient that you have treated and the oldest patient you have treated?
Yeah, that's interesting. Yeah, youngest I have treated is 13 years. He was son of my colleague who was a cardiac surgeon, and 13 years boy developed 150 kilo. And when he developed diabetes, then the father became very scared. And we did it, surgery, of course, diabetes went away, and he came back to normal. And later on, I know that he came to US for studies, and he became captain of his football team, a college football team. Wow. So such a big transformation happened.
Yeah, that must be life-changing for him.
Yeah, and the oldest patient was, I think, 67. Very enthusiastic lady, had multiple of surgeries, knee, this, that. And she told, no, I want to reduce, I want to swim. And she was an American patient, staying in Dubai. So I was a little cautious because 67, 68, I don't know why you want to have surgery. She told, no, I want to swim. I want to dance, Yeah. And we did a surgery, and very positive frame of mind, that lady. And turned out to be very nice. Within 6 to 8 months, transformed again, very active. All aches went away, walking. And she sent me a note also that I can swim, I can walk, I can dance with my husband.
Oh, wow.
So, interesting parts, yeah.
That's amazing. 13 years, that's 13 years of kid. I mean, that must be something. I mean, how did you feel at the time when you were treating that kid?
And yeah, that time was the initial phase when we started establishing bariatric practice in UAE.
Okay.
So I told his father, and that is possible to reverse it. And then we did surgery. It was little convincing has to be done to the parents, to the mother especially.
Yeah.
And of course, we have to teach child also. Yeah. Took 3 to 6 months to prepare him also, psychologically, everything. And then we did the surgery. And the result was excellent, transformation was excellent.
So people come to you from all over the world?
Yeah. Yeah, a lot of patients, they come from Africa, from Europe, from Australia. Even initially, I have few patients from Canada also, from US also. Yeah. Now, number of this tourism is getting reduced because everywhere is well developed bariatric surgery. Initially, we used to receive from everywhere.
Like people from India also used to come to
Oh,
you?
yeah, still they come.
They still come.
Mm-hmm.
Which part of the world people used to come most from?
Europe, Australia, South Africa. I have still patients I'm receiving.
Okay.
I think next month I'm operating one South African girl. She's around 20 years old girl.
Okay.
Yeah, and from practically from everywhere. Numbers are less comparatively. 10 years back, more numbers were there. Now it's a bit less, but still I receive from Pakistan, from Nepal, multiple countries. Yeah.
So, what are the risks of belly fat?
Belly fat is called central obesity. So central obesity is more dangerous than generalized obesity. It affects your pancreas also, and it can cause, one of the main choice, especially in South Asian patients. The central obesity, if you see South Asian patients, they are centrally obese. Peripherally, their limbs are very normal, not like European patients here. And this is more dangerous for metabolic problems like diabetes.
Okay, and can it also cause cancer?
Yeah, in long term, all obesity can cause
any kind of, it could be general.
There are 8 or 9, maybe more now, listed cancers which have a relationship with obesity. Many years it takes, but fat cells releases some kind of and grossly we can say hormones, inflammatory markers they release. And chronic inflammatory markers in your body released by the fat because you're obese. When it's chronic, then the inflammation state of the body is high. And chronic inflammation is one of the cause leading to the cancer. That's how it causes cancer in the body.
How do we get belly fat? Usually, like what kind of drinks, what kind of food?
As I told before, processed food low in fiber, more high in fat and sugar. These are the main things culprit causing it. And if you add on the top of this inactive lifestyle, then you had it. All these together will cause the obesity. It can cause central, it can cause the whole body obesity, and depending upon the racial features or race, like South Asians, they are more prone to develop central obesity.
So, like most of the people who come to you, they suffer with central obesity, or they come from general obesity?
Well, general and central both also. Yeah.
Any like very something that you remember, any story from one of the patients where they came in, and any transformation story that you remember out of that?
2 I already told you.
Yeah.
There's so many.
How many patients have you treated, by the way?
Pardon?
How many patients have you treated?
Obesity surgical, non-surgical more than 1,500, and surgery is also more than 1,000.
Wow.
I'm talking about only bariatric surgeries. Yeah.
Okay.
So good numbers. Yeah.
Yeah, it's pretty.
I remember one. Yeah. Since podcast is going from Canada, Canadian from Toronto.
Okay.
He came to in Abu Dhabi with the collaboration with Canadian government. They have launched nuclear reactors here. So he was one of the engineers there. So he came for gallstones. So I told him, let's do the ultrasound and find out why you have gallstones. So gallstones I related with obesity. It was long back I'm talking about. So I discussed with him, and that time awareness was very low. So I talked to him, I told him, see, he was taking medications, 10 kinds of medications, for blood pressure, for cholesterol, for respiration, for heart problems, and for gallstones. So a lot of medication he used to take every day. So he told, I won't have surgery for gallstones. So I told him, no, root cause is your obesity of all. So let me deal with your obesity rather than I do gallstone and send you home. So he got convinced. So I proposed to him gastric bypass, one of the weight loss surgery. I was in Abu Dhabi, head of surgery in one of the hospital there. So I did gastric bypass for him. And his wife came after 1 week for review. I do routine review. So she came and she was very upset with me that what kind of a surgery you have convinced him. He has only simple gallstones and you convinced him for other kind of surgery and we don't understand and it's not good. Little bit, she was more mad on me.
Angry?
Yeah, angry. And within 3 months, he stopped all the medications. 8 to 10 medication he used to take. Means all the associated problems went away. Of course, I did, along with bypass, gallstone. Cholecystectomy I did also, means removal of gallstones and gallbladder. So within 3 to 6 months, he was totally transformed. The same lady comes to me and begs me that I want to have a surgery for my diabetes. You see that change now?
Yeah.
So I told her, I treat diabetes with obesity. You are not obese, I can't treat your diabetes. Next 2 to 3 years, she was every 6 months used to come to me with husband and every time operate upon me. I want to improve my diabetes. And of course, I couldn't do surgery. It was not recommended as per our ethics and principles. So you can see the same family who was criticizing me and later on she's begging me, which I'm not able to do. And still she's pushing me, please do it for me, for my diabetes.
Wow.
So that's how the things changes.
Yeah. I'm pretty sure 1,000, 1,500 patients. I mean, you might have endless stories of different people coming from
lots stories.
Yeah. Tell us something more, or like I think this is very interesting. Something like this.
What more we can say? Down the line, maybe if I remember, I'll share with you.
So now we'll be talking. I want to discuss a little bit about nutrition and gut health, all of that stuff.
Mm-hmm.
How do you think nutrition and gut health is important for managing obesity?
Yeah. So according to the recent researches, the gut has microbiomes. There are different kinds, millions you can say, and some are good, some are bad. So in rats, a lot of studies has been done. So they have done, they planted gut bacteria from obese rat to a normal rat, and within few months they saw that normal rat gained the weight. So there is something gut bacteria of obese transmits there. Another study they did in rats was they did microbiota free sterile gut rats, and they turned out to be slim rats. So that indirectly shows that gut bacteria are very important. There are different kinds of gut bacteria are there. A lot of research is going on. And regarding nutrition, as I told you that if you are eating healthy, more of it, whenever, in life you are confused between two things, which one to take, whether it's nutrition or lifestyle or anything in the life. So my principle is I choose which is near to the nature. And that's how in long term you win up. So in food also, organic food is much better, natural food rather than processed food. Processed food is well known, there are well known to gain weight. One interesting part I want to share with you, in Pacific Island there are 2-3 countries, small countries. So in that what happened, when colonization happened there, and the food turned to processed food, and slowly there's no natural food there. And the percentage of obesity on those small countries in Pacific Island is about 60%.
Wow.
Yeah.
Crazy.
So you can see the effect of food.
And what would be the total population of that?
Oh, that's very small.
And probably most of the people are obese.
Yeah. There's one reporter went there, stayed few days, and he told, I can't even see a fresh vegetable there. So all food comes from outside, processed food, and they eat on that. 60% of obesity, the highest obesity rate is in those countries. Yeah.
Wow. So they might be the top in the world in comparison to... Yeah, I was reading, there were some weird names, I can't remember right now, Osana, something like that.
And Pacific Island...
There are islands near to America.
Yeah.
They come
exactly,
under,
yes.
Yeah. Wow, really? I thought like United States or India would be.
No, no, no. Those are another typical example of diet change to processed food, no fresh fruits and vegetables, and lifestyle may be lazy,
Yeah.
and it turned out to be 60% of obesity. Yeah, I don't
That's
want to
great.
name those countries, but yes, it's in the Pacific.
No, it's there on the reports. I
Yeah, you
think.
can find on that.
Yeah, there are statistics. I was just yesterday because when I was researching a little bit about food and obesity, two, and I've never heard of them. So which is why it was even more fascinating for me. How come? I mean, why don't you know about these two countries, two islands, and they're number one in obesity? I can't even remember their name now.
So that shows how the diet and lifestyle changes can lead to obesity. Yeah.
That's crazy. So, what do you like in your in your experience? Um, what kind of food is the worst for your health?
As I told you, processed food.
Can
Yeah.
you name what kind of processed
See,
food?
alcohol, number one, it causes fatty liver and gain in weight. Number two, all those fried food.
Even French fries
Yes,
and
of
all
course.
that.
French fries are very notorious, yes.
I love French fries. I don't love it, but yeah, when you
Yeah.
go out and you have
See, once in a while is fine.
once
yeah.
in a while
Yeah.
is fine. Yeah, yeah.
The portion size, especially.
I can say that to myself. Once in a while is fine.
And the portion size.
The portion size.
Yeah.
You know what? North
See,
America.
yeah.
I've seen the difference. I'm sorry, I'm cutting you. I've seen the difference. The portion sizes here in North America are way larger
Very large, yes.
than in comparison to what is in India and Middle East.
Exactly.
How is that? Why?
In Middle East also portion size
Now,
is large.
yeah, Middle East might
You
be
know,
there too.
so everywhere the Western food has taken over. In India, I remember when I was getting trained for bariatric surgery or laparoscopic surgery, I got an offer from North India in Delhi, one of the hospital, to come and establish a bariatric center. I refused. I thought in India, where is the obesity? So finding patients will be difficult. I'm talking about 25 years back, 25 years back, yeah. So I told no, I'm not coming there to establish center because what obesity is there? There is no obesity. And when the typical American food entered, burgers and those,
They spoiled everything.
the urban obesity increased a big number within 10 to 15 years. Now I think I should have shifted to India that time. Would have been the leading bariatric surgeon.
But you still are. I think what
Yeah.
you did in UAE is pretty
So,
commendable.
so the diet changes how it transforms the society. Yeah. See, I always tell my patients the two things keep in your mind for everybody, even for me, for you, or for obese person. Food, it should be healthy food. Eat slow.
I'm guilty of that.
Yeah, most of the people can't eat slow. It's a very simple, but they can't. They are wired to eat fast.
Yeah.
Whether you're busy with watching TV or your mobile or you're thinking something.
The biggest problem with me is that I just gulp.
Yeah.
And I might be the first person to finish all the meal. I'm like, what's next? Let's
So
get started with
I'll
it.
tell you how it's important. Suppose, see, from stomach, the poor stomach is blamed. No, it's all in the brain. From stomach to the brain takes about 15 to 20 minutes to send a message that I am full. And then brain will tell you stop eating. So suppose you are eating fast. Now it takes 15 to 20 minutes. If you are eating fast, you have 4 burgers in your plate. You will eat 4 because in 15-20 minutes you can finish 4. But if you're eating slow, you may not be able to eat 1 or maybe 1.5 burger because within 15 minutes the stomach is giving signal now. But for the first case, what happened? Stomach is not able to give signal. It will take its own time, but you gulp the 4 burgers. That's called overeating. So eat slow, eat healthy. Number 2, take activity of your choice, which you can do 5 days a week. 2 days rest for you. So if you can take gym, you can do swimming. Okay, you can't do those kind of things due to whatever reason. walk 40 minutes a day, 5 days a week, eat healthy, eat slow, you will maintain whatever status is you having.
Wow.
So these two simple things in the life
Yeah.
can cause amazing difference.
Yeah, I'm really guilty of not eating slow. I mean, I've tried. My wife also says the same thing. I mean, EAB, like all the people in the office, also they also say that, oh, he's already finished. He's already within 5 minutes. I'm done. But the difference is that I don't feel hungry that much. Also, like when I whatever the plate size is, I will just finish that, and it's not like I feel too bloated or I feel too empty. Uh, right after, even if I've eaten within 5 minutes or something, because maybe I've trained my mind to just have whatever it is and not, because like I told you, because I've had a major transformation from
Yeah.
90 kgs when I was 15 years to 60 kgs. I lost 30 kgs of weight. So maybe at that time I developed that kind of a thing that, whatever I'm doing, I'm not doing it for um, it's a switch on and switch off button. This is what I say to myself, that I'll just switch off, that humanity switch kind of thing. I'll just switch it off and I'll just do it for existing. So I started treating food as just a need for existence. So that way, whatever came to my plate, even if it was, because when you are losing weight and when you go to the gym, your personal trainer and everybody says that have lots of eggs and I used to eat, like, at time I used to eat 24 eggs in a day too, and I just used to gulp them, So I think that just trained me to not attach myself with food and get attached to it and just have it just for the sake of it. Just, yeah. But now I've started feeling a little, I have French fries here and there sometimes.
Your brain is wired, is afraid to
Yeah.
get connect with the food, maybe, because of past experience.
Past experience, but yeah, I told you, right, like my past experience for gaining weight was not too much related to food, but it was more related to steroids that I took
Yeah,
because
a
of
lot of
my
medication can cause.
yeah. And to be really honest, I didn't do too much to reduce weight too. I At one point of time in my life, my weight suddenly started reducing automatically, and I went so thin that I started feeling like mal nourished or something like that. I used to get a little blackouts or something like that. Or maybe I thought, oh, now I've reduced, I don't want to eat too much.
Yeah, exactly. That psychological factor comes. Even my patients, if they gain 1 or 2 kilograms, they panic and they call, I'm gained. But that's a normal variation. Yeah. So brain gets wired, afraid to gain.
But for me, what happened? Yeah, that time it happened. That started happening. But now it is completely opposite. That if I don't eat, I'll start reducing weight. Earlier it was like I'll stop because I don't want to gain weight. I'll stop eating. But now I'm wired that this metabolic activity also changes over the period of time in your age.
As I told you, the metabolic things changes, and the brain controls everything. Yeah. In hypothalamus, there is neurons are there are centers are there, which causes, you can say, reward phenomena also gets activated there. So the appetite, the hunger, the satiety, both centers are there.
What are the social issues that happen and that are caused due to obesity, according to your experience?
See, obese people, they have a lot of anxiety, depression. Lots of my patients who come for surgery, they are already on antidepressants also. And self-confidence is very low. These are the factors. And on the social side, we can say that a lot of bullies are happening. A lot of body shaming comments comes to them. So they feel very insecure, and their lifestyle confidence is very low. So these factors rampant, I find, in more than 50% of my patients. Yeah.
Are they mostly men or women?
Both. Surprisingly, not much difference. But if statistically we see, then you can say women are a little more numbers, but men also not very significant, huge difference. No.
When do you think a person should go for surgery for weight loss?
Yeah. As we discussed before, body mass index. Yeah. See, once your body mass index, we follow guidelines from ASMBS USA, American Society for Bariatric Surgery. The latest guidelines are that 35 body mass index and onwards, you are eligible for bariatric weight loss surgery. Different kinds are there. Between 30 to 35. Up to 30 is overweight. 30 to 35, if you developed two diseases because of obesity, like hypertension, diabetes, sleep apnea, those kind of things, then you are eligible for bariatric surgery. Now, coming to the category between 25 to 30, we offer non-surgical solutions. That's called gastric balloons. There are different kinds. And there's one endoscopic sleeve gastroplasty or ESG. That's a beautiful procedure without surgery. It mimics surgery. So that's between non-permanent or temporary gastric balloon and permanent surgery. It's a permanent but non-surgical it is, in which through mouth we put a tube and we do the stitching, which are permanent stitches and reduces the size of the stomach. So we make the size of the stomach permanently smaller. So the portion size comes down and little bit hormonal changes comes. So you can lose 15 to 20% of body weight by this procedure. Surgery is still the best if you qualify for surgery. Long-term maintenance and the weight loss is more.
And this is like when you're talking about that balloon, that is completely non-surgical?
Yeah, that's completely non-surgical. There are two kinds of gastric balloons. One is very simple, like walk in, walk out. Burger King, you drive in and drive out. You can, there is Aileron. It's a beautiful invention. So Aileron is a smart capsule. All you have to do is you swallow a capsule with water. We check under X-ray. It's in the proper place. We fill it up with sterile water. There is a connector. So 550 milliliters. So it stays in the stomach, takes the part of the stomach, and the connector goes off. We check again, everything is fine. You go home. Takes around 10 to 15 minutes.
So it takes away the part of that stomach and goes out of your system.
The stomach is not empty. You see, when stomach is empty...
Oh, it takes the part of the stomach, like as
space.
In space in this. Okay, got it.
So when stomach is empty, you feel hungry.
Okay, got it.
Now stomach is not empty. There's a 550 milliliters balloon size is lying there now. So it causes less appetite, your fullness is more, and of course your portion size goes down, you lose. And the best part is after 4 months, there is a wall. It dissolves automatically.
With the same procedure?
The same balloon. After 4 months, wall dissolves, water goes out, it collapses, paper thin, passes out.
Wow.
No need to come back for removal even. So people who are traveling for them, it's beautiful. The other kind of balloon is for 1 year, but through endoscope. Quick procedure, 15 minutes, but you have to sleep, sedated. We place under vision, make the size as per your stomach. And then within 1 year, whenever you want to remove, we again go it, puncture, take out the liquid and take it out.
So this takes just 15 minutes?
Yeah, 15 minutes.
And the other one is just a capsule?
Yeah, that's a capsule. Yeah.
That's amazing.
So that's non-surgical. Very popular.
And what about surgical?
Surgical, between surgery and non-surgical, I told you endoscopic, sleeve gastroplasty, ESG. Surgery, there are laparoscopic surgeries. There are different kinds. The most popular is gastric sleeve, in which we reduce the size, we cut the part of the stomach. So refashioning the stomach, around 60-70% of stomach goes out. So this is called sleeve. It's the most popular, number one.
Is it painful?
You are sleeping.
Even after the surgery, like, do you feel anything?
First day you might have some pain, but you're in the hospital. Painkiller can be given. Next day onwards, discomfort may be there, but no pain. Usually I teach with my patients so that they will remember. 1 hour surgery, 1 night in the hospital. 1 year my team will follow with you.
Okay, that's
so one.
That's nice.
The another surgery which is popular is gastric bypass. 2 kinds. mini gastric bypass and Roux-en-Y gastric bypass, medical terminology, in which a loop of the intestine food doesn't go. It's bypassing that loop. So you, even despite eating, you absorb less. So malnutrition component is there. That has its own problems, but yes, that's also very effective. These are the 2 or 3 procedures which are very popular worldwide.
And in what kind of a procedure, what kind of a treatment have you given to most of your patients so far in your career?
Now, 70-80% is sleeve.
Is?
Sleeve gastrectomy, sleeve surgery.
Okay.
In surgical parts, this is the number one.
Number one.
Yeah. See, next month, I'm traveling back on Saturday. So, on first, I have a bypass. And then 6 patients are waiting, all are sleeve. So that's so popular now, so common.
And it takes just 1 hour for that surgery?
Approximately.
Approximately. And they're traveling from different parts of the world again?
Different parts and from local also. Yeah.
Local also.
Yeah.
Who this surgery is not for?
Obvious. If your body mass index is below 27, 25 or below 30, you're not a surgical candidate. Then we talk about diet, which we discuss how to eat, what to eat, active lifestyle, and maybe non-surgical gastric balloon. And now medications have come up, which are agonists for the hormones like GLP and all, means very popular now. The Hollywood stars have made it very, very popular. Semaglutide, and then there's tirzepatide, is known as Mounjaro, is very popular now.
What happens in these?
It acts in the brain central and reduces your appetite significantly, and you lose weight.
Oh.
Like the latest one is tirzepatide or Mounjaro, made by Lilly company, Lilly. I'm on their advisory board, and once a week you have to inject subcutaneous, like insulin. Yeah. And it's quite effective, yes.
It's crazy how the inventions have come like this with a small thing.
They started for diabetes, and the side effect they saw weight loss. So they got interested, they did research and came out with that. And more than 1 billion people are suffering from this problem.
Of course.
So it became very popular.
So celebrities are promoting these kind of pills?
Big way.
Like who?
Hollywood stars.
Mostly Hollywood stars. They're using it and they're also talking about it?
Yeah.
These kind of treatments, are they affordable?
Yeah, they are affordable. Means general treatment can be a little costlier as compared to general treatment, but they are affordable. Life-saving things cannot be cheaper also. I'll give you different parts of the world, different charges are there. In Dubai, we charge around $10,000 for surgery.
So what do you envision the future of weight loss surgery in the coming years?
Yeah. See, not only weight loss surgery, we can think about weight management instead of surgery, the different aspects. World is going into more and more less invasive. When you cannot do less invasive procedures are not effective, then you go for invasive procedures. So surgery has its own role, but more and more non-invasive things are coming up. Like endoscopic, I told you ESG, gastric balloon is non-invasive. And then we talked about the latest medication, Mounjaro. So world is moving in that direction. A lot of research is coming up. A lot of medications are coming up. I hope more effective medications will come up, then we surgeons will be out of practice. But surgery has its own area, and failures will come from non-surgicals. Then there is no other alternate than surgery. A lot of new procedures have come up, but what we discussed, these are the main at currently. A lot of research things are coming up with medications and with new surgical procedures also, and new endoscopy procedures also. But world is moving towards minimal invasive things. So this is one part. Now, most popular, I told you, sleeve gastrectomy. This is the most popular surgery. In that, one new thing has come up. Till now, see, stomach is long. When we cut, we use staplers. we fire staplers, and one fire stapler, longest one available, was 6 centimeters. And stomach is more than 20 centimeters. So 1, 2, 3, 4, 5 we used to fire. Now the new has come up, research in the US, available now. And I introduced 3 months before in Dubai. Exclusively I am doing that. Single fire. Means instead of multiple, 4, 5, 6, single stapler. So what is the advantage? Number one, the cut, the hand movements and all junctions of multiple is not there. Smooth cut is there, just like a original stomach. Chances of nausea, vomiting, reflux are less, as per research papers, and is quick. Anesthesia time is reduced. See, my nurse will, I'll give gun to her, she will put another one and then give it to me, then I'll go in, then I'll fire, wait, and then give back. She will load another one, give me again.
Oh, it's 6 times.
So it takes time.
Yeah.
In this, one loading, I am in, I adjust. Once I'm satisfied, I fire. Smooth. Takes less than 1 minute to fire it. So anesthesia time is reduced, recovery is better. So this is the new in sleep surgery, which is very popular surgery, number one. Similarly, in medications, the latest is Mounjaro. The same Lilly company is working on another medication. Hopefully will come in the market soon. That will lead to more weight loss. So that's another significant step in non-surgical or without procedure weight loss. So these two things are there now.
So now we are in the final section of our podcast, and I have written some bunch of questions. You have to tell whether this is a myth or it's a truth.
Most welcome.
Okay. Skipping meals can help you lose weight.
No, myth.
Stop having carbs if you want to lose weight.
Initially, yes, but in long term, no. So you can say myth, yes.
Most supplements and pills are not effective for weight loss.
Can you repeat it again?
Most supplements and pills are not effective for weight loss.
True.
You can't lose weight after a certain age.
Myth.
Fat diets like keto, paleo are the best way to lose weight.
Myth. For again, temporarily, yes. In long term, no. Same like carbs. Body needs carbs. A part of the healthy food is carb. So initially, if you are, suppose, weight gain, obese, you stop carbs. Yes, it's good. High protein diet, low carb, low fat.
Yeah.
But in long run, if you remove carbs totally, in long run, it can cause problems, deficiencies in the body. Yes. So same is with this question.
Okay. Drinking a lot of water alone will lead to weight loss.
Myth.
Eating late at night leads to weight gain.
True.
Is it?
Yeah. The body's circadian cycle, you have to go with that. People who do night duties, they gain more weight as compared to the normal population.
You cannot regain weight after surgery.
Myth. Certain population, 5 to 10% percentage of surgical patients might gain in long term.
And that is because of their own eating habits?
Exactly.
People with obesity always overeat.
Myth.
Why do you think? What could be?
There are so many factors. Again, now giving them 100% myth, you cannot say. There are patients, the portion size is not big. They have a genetical factor, familial factors are there.
So like hyperplastic.
Yeah. Now, if we say that most of them overeat, yes. But labeling that everybody eats overeating, no.
I get it.
So 13 years boy, genetically engineered, obese parents, chances are there, even if he's normal eating, he will gain weight. So it's very difficult to say myth, 100% myth or 100% true.
Bariatric surgery for weight loss is not for kids.
Myth. Kid beyond a age when he can understand, like 13, 15 years, and we have done the psychological counseling, evaluation, and tried diet, exercise, everything fails, and he's developing problems, metabolic problems, is the right candidate for surgery.
Perfect. This is the end of Myth and Truth. Thank you so much, Dr. Girish. One last thing that you would like to tell viewers about weight loss and management. What would you like to say?
Yeah, lead a normal life, which means active life. You have to do some activity of your choice. Number two, eat slow, eat healthy, keep away from processed, fatty, and sweet part of the food. Live your balanced life, control your weight, don't come to obesity, which causes lots of problems in the body. So try to be smart, prevent it beforehand, and in case you fail to prevent or you start gaining it, take expert help as early as possible before you get your body damaged.
Thank you.
That's
Thank you so much.
Thank you very much. Yeah.
So where can people reach out to you?
Yeah, we have a website, www.weightlosssurgerydubai.com. Number two, we have a coordinator's number, is available on website also. You can WhatsApp, you can email, you can do the form filling, or you can call her also. So very easy, and she responds very quick, 24 hours a day.
Perfect. We'll also put it in the description.
Yeah, thank you.
Thank you, sir. So nice meeting you and pleasure talking about
Thank
obesity
you.
and weight loss. Such a wealth of information you are. Thank you.
Thank you. Enjoyed talking to you, and hopefully it will be very educative podcast.
Yes.
And regarding myth and truth, there is a gray areas. Exactly, we cannot say 100% to all. So be careful about that. Yeah. Thank you.
Thank you, sir. Thank you for listening to this podcast. And if you're not subscribed yet, then click right now and subscribe, because every week I'm going to post a video or a podcast, and it is going to be about marketing, content creation, and business. And if you want to check out some other videos and interviews, then here are some of my recommendations for you.